I'm Dr. Raul Hazare. I'm a professor, Sandeep University, School of Pharmaceutical Sciences, India. I'm a scholar of Hindu University of America in Florida. My topic is the cause, present treatments, and the potential future treatments for polycystic ovary syndrome. So, in that, the first we will see the abstract. The polycystic ovary syndrome, it is commonly known as PCOS. It is a complex endocrine and metabolic disorder typically characterized by the anovulation, infertility, especially seen in obesity, insulin resistance disorder, and polycystic ovaries lifestyle and diet, environmental pollutant, genetic involvement, gut dysbiosis, neuroendocrine alteration, and obesity are among the risk factors that PCOS is occurred. This factor might contribute to upstream metabolic syndrome by causing hyperinsulinemia, that is an oxidative stress, hyperandrogenism, impaired folliculogenesis, and irregular MC, that is a menstrual cycles. Dysbiosis or the gut microbiota may play a pathogenic role in the treatment of the PCOS. The restoration of the gut microbiota by probiotics, prebiotics, or overall the fecal microbiota transplant might serve as an innovative, efficient, and non-invasive way to prevent and mitigate PCOS treatment. This review deliberate on the review and extended primary work on the variety of the risk factor potentially involved in the etiology, prevalence, and modulation of the PCOS. In addition to the plausible therapeutic intervention, including miRNA therapy and the eubiosis of the gut microbiota, that may help to treatment to manage and regularize the patients who have suffered from the PCOS. In introduction, one of the most prevalent endocrine system condition affecting women of reproductive age in polycystic ovary syndromes, also known as hyperandrogenic ovulation or Stein-Leventhal syndrome. The chronic and heterogeneous disorder manifests itself as a menstrual dysfunctioning, more bleeding, infertility, hirsutism, acne on the cheek sides, especially on the upper side of the cheek corner, and obesity. It describes a condition where at least one ovary has an ovarian volume greater than 10 ml and at least one ovary has an estimated 10 small cysts with diameters ranging from 2 to 9 mm develop. It may also convert into the gynecological complications. It may develop some gynecological disorder from the maybe we can say that it is a primary level of the malignant. It is usually only diagnosed when the complication develop at a significant reduce a patient quality of life, especially has been seen hair loss, alopecia, acne on a particular area of the face, infertility related problems. According to a systematic screening of the woman using the National Institute of the Health diagnostic standard, 4 to 10% of the reproductive age women are predicted to have a PCOS worldwide. The WHO estimate that in 2012, PCOS affected 116 million women globally. The high frequency as well as the link with ovulation and menstruation abnormalities, infertilities, hair loss, and metabolic issues underscores the PCOS significant financial burden. Although PCOS can occur at any age, beginning with the menstrual physical maturity start, the majority of the instances are identified the woman age of the 20 to 30. PCOS affected 1.55 million women of reproductive age worldwide, resulting in 0.43 million disability adjusted life year. That was not diagnosis right time for the right treatment. The age standardized incident rate of the PCOS in women of reproductive age was 82.44 per 1 lakh in 2017. 1.45 higher than in 2007. The graph of the PCOS, it increasing linearly and non-linearly. Recent research reveals that PCOS is lifelong syndrome that first manifests during the pregnancy. Although it was traditionally thought to be a disorder that only affected by the adult woman. Phenotypes of the PCOS. 4 phenotypes should be understood, have been identified by the medical community that can be regarded as a variant of PCOS based on the three key parameters of the PCOS, which are anovulation, hyperandrogenism, and polycystic ovaries. The 4 phenotypes consistently range from the most severe phenotype A to least severe, that is the phenotype D, along an axis of the metabolic and ovarian dysfunctioning. That is a newly introduced by the medical community that should be a metabolic and ovarian dysfunctioning. Disease pathology to understand. Across the globe, PCOS affect between 8% to 20% of the women of the reproductive age annually. According to the diagnostic criteria, the pathophysiology of this condition is influenced by the alteration of the stereogenesis, ovarian follicles genesis, neurocrine function, metabolism, insulin production, insulin sensitivity, adipose cell activity, inflammatory factor, and sympathetic nerve function. It's all about to understand the abnormality of the woman showing in their physics. Abnormal physics of the women are especially a victim of this disease. It has one of the scientists recently represented in the Rome. Why the systematic physics of the women's are not or not will be a victim of this PCOS, but the things should be a cells, especially for the adipose, less metabolism, irregular of insulin production and sensitivity that leads to the PCOS. According to the one of the scientists, Barre and their co-author, high consumption of the carbohydrate, there is a mismatch of the food, hyperinsulinemia, hyperandrogenemia, and the persistent low-grade inflammation. Food that contain the 4 key contributor to the pathological alteration of the PCOS. It is important to choose the matched food, especially for the women, to get out from the PCOS. Medical treatment, it is an option, but the things is there, some level of the medical treatment they may help us to survive from the PCOS, but the lifestyle and the match of the lifestyle, match of the day is important, especially for the women's older woman, adult woman, or they are at the stage of the adults. Now, hyperandrogenism. The biochemical hallmark of the PCOS is hyperandrogenemia, which manifests clinically as a hirsutism, acne, alopecia sign. High level of the androgen are observed in 75 to 90% of the PCOS patient with oligomenorrhea. Alopecia, that is it is a stated the abnormal hormone secretion in the women who are in the list of the PCOS, and their concentration frequently increase. So it is one of the things to understand that why the women are not women. Thymus contains the female hormones. Alopecia, that is one of the reason there is an imbalance of the woman's hormones, less percentile, it may be there. That is the reason increased with the severity of the phenotype. Excessive androgen synthesis by the ovaries as well as the adrenal contribute to the hyperandrogenism, increase the level of the abundant testosterone and the major hormone contributing to the pathogenesis of the PCOS. And indicative hyperandrogenism is a reason. Abnormality comes, and it is important to understand, abnormal ovarian or the adrenal function leads to the overproduction of the androgen. That is one of the reason. That is one of the reason to the PCOS. It is the abnormality. The things is that the abnormalities came from the lifestyle, came from the mismatch, came from the something should be the alignment. The woman's is not matched with the alignment with the nature. In PCOS, impaired folliculogenesis is the initial effect of the excess androgen disrupting normal androgen synthesis. Against the nature, woman is going to against the nature. Globally, especially for the women's, are the skin having the less brown. White woman, I have seen globally, there is a less chance of the PCOS. She has to be aligned with the natural hormones, especially for the white woman. White woman, this problem should be a lead into the Asian country. Skin are the less white, less brown, or it may the fed up skin is there. It should be the I am to add into that. At the early gonadotropin stage, excess androgens encourage the growth of the primordial follicles and rise in the antral follicles. It is one of the sub-cause of the PCOS. That is the country are the country, especially for this type of the women's, they not understand about the primordial follicles and rise in the antral follicles. So the women's from the other than the white country, the majority is more. So it may understand the So where the women from this country went wrong, they may correct or they may do the next level from the medical community. They can ask for the support, they can ask for the help. And alter cortical metabolism is another proposed mechanism that contribute to excess androgen in PCOS patient. The enhanced inactivation of cortisol by 5-alpha reductase are also known, or impaired reactivation of the cortisol from the cortisone by 11 beta hydroxysteroid dehydrogenase type 1 may cause increased peripheral cortisol metabolism. It's all the enzymes which results the less negative feedback suppression of the androcorticotropic hormones secretion while maintaining the normal plasma cortisol concentration at the expense of excess androgen genes. Various genetic factors are associated with the abnormal sterogenesis. There is one gene, CIP genes, involved in sterogenesis play an important role in androgen production. CYP, these numbers may be CYP genes will be involved. It is a mismatch while the woman's exploring their womanness. That time it may C went wrong. That time CYP genes will be involved for the excessive androgen that may extend to the PCOS and are considered play role in hyperandrogenism in the PCOS. It is one of the cause, one of the class of the PCOS that woman wants to understand that how the CYP gene should be the involved. It may the CYP, it is a match genes for their womanness. So the answer is not. Hyperinsulinemia. Insulin is the main hormone in charge of the both lipogenesis and glucose homeostasis. Insulin serves as a mitogenic hormones in addition to having an impact on the metabolism of the carbohydrate, fats and proteins. Insulin receptor, which are present in many tissues of the HPO axis, mediate the activities of the insulin. Insulin potentiate the corresponding tropic hormones in stereogenic tissues such as ovary and adrenal cortex to encourage androgenesis. And insulin directly mimics the action of LH and indirectly raises the GnRH. Hyperinsulinemia in the primary cause of the excessive androgen production. Sex hormone binding globulin, key circulator proteins that regulate the testosterone level, is decreased by insulin. Therefore, lower SHBC level would lead to the higher level of the free androgen, which cause the clinical symptoms of the PCOS, such as hirsutism, alopecia, and acne. This is one of the primary show up. The women should be in the category of the PCOS primary level before the medical examination. Numerous studies have shown that the lowering insulin resistance will ultimately result to reduce the androgen and improvement in the disease condition. That is one of the positive sign. Lowering insulin resistance. Cause and risk factor. It is difficult to identify the positive factor of this multifactorial condition due to its complex interlinked pathophysiology. The origin, prevalence, and modulation of the PCOS phenotype may be affected by the environmental pollutant, diet, lifestyle choices, genetic factor, obesity, and gut dysbiosis. Gut dysbiosis, it is one of the factor that there is a special research is important, but that is okay. We cannot we can't control the gut dysbiosis, especially for the such a normal country woman. These factors might lead to the cause of the excessive androgen secretion from the ovaries. Ovaries and the onset of the insulin resistance, partial folliculogenesis arrest, and the chronic low-grade release of the inflammatory mediator from the white blood cells. Upsurging metabolic syndrome. Etiological role of the environmental pollutant. Various studies have shown that environmental pollutants such as heavy metals, insecticides containing foods, endocrine disruption chemicals significantly affect human health and the reproduction. That is the reason the infertility is increasing, is rising the day by day. Indeed, there is a mounting evidence that environmental pollutant contribute to a development of the PCOS. That is cannot in our hand, but we control. We will be controlled if we have the hope to come out from this PCOS disorder. One of the scientists, that is a Takuchi, and its co-author discovered the serum PBA level of the hyperandrogenic, especially for the women with PCOS, were greater than the non-hyperandrogenic woman with PCOS and healthy controls. Excuse me. A separate study found that increase in the blood PBA level were positively associated with the serum testosterone level in PCOS woman versus healthy woman. Ascertain the relationship between the various environmental pollutant and PCOS. Excuse me. Study reported higher serum level of the perfluorooctanate and perfluorooctane sulfonate in women with PCOS. A negative associations between the phthalate body burden and PCOS was also noted by the group. Negative associations, the negative association, it may be the, we can say that it may be the trace and the conflict environment. To more precise, monobenzyl phthalate urine concentration with lower in PCOS afflicted woman. Role of the diet and lifestyle. These are the one of the study. Positive correlation between the PCOS incidences, smoking, exposure to the cigarette smokes. Smoking was found to be associated with the ovary dysfunctioning in dose-dependent manner. Study that included that the anovulatory woman with PCOS, woman with the normal anovulation in the PCOS and healthy control. Inflammatory conditions characterized by increase the mononuclear cells. Mononuclear cells. Increase in a mononuclear cell. Cells should be handed to get the new cells every day. If the cells are the mononuclear, it means that the body has to the inflammatory conditions. So that may lead the mitochondrial dysfunctioning. Inflammatory condition, it is a online exercise, but if the target has been fixed, but if there is an impulsive exercise, impulsive exercise that may lead to the inflammatory condition that may increase the mononuclear cell. Body do not want the mononuclear cells. Body want the small circle of the cells that may handed to grown from the senior cells to their seniors. If not, it may lead to the mitochondrial dysfunctioning. That is one of the reason of the PCOS. It may the new area of the research in the field of the woman's health. Reproduction in the GSH as well as the oxygen uptake, oxidative stress, and decrease the antioxidant level. That is one of the you may aware about the antioxidant level as well associated with the PCOS and the smoking. Smoking, it is one of the cause. It may one of the cause, but the seriousness what I found that is the mononuclear cells that may mitochondrial dysfunctioning. This study has been conducted by the white country, that is Taiwan, and they reached to the result. Pollutant gases SO2, NO, NO2, NOx, PM was associated with the increase of PCOS risks. White women are not trapped in the PCOS, especially why such a Asian country should be one of the top of the PCOS. I'm not hesitate the saying that it may the Indian woman. Yes, I'm saying it's a Indian woman's top on the PCOS. Role of the diet and lifestyle. Lifestyle changes are the primary line of the treatment of the woman with PCOS, but they are not an alternative to the pharmacological treatment. Regular physical exercise, maintaining a healthy body weight, adhering to the healthy dietary habits, abstaining from the tobacco use are all important in the prevention and treatment of the metabolic disease and are recommended in the clinical guideline for the variety of the alignments. Okay, they are the general precaution, but the right diagnosis is different. I'm saying the right diagnosis is different. It is not coming out to the picture. The very few people, 3% people know the fact. Role of genes and genetics. PCOS is a polygenic and multifaceted disorder, and it has been shown that certain genes interaction, that is a match interaction genes, or interaction between the genes and environment might affect the person prosperity to develop the PCOS. Several genetic studies has suggested that several potential genes with the single nucleotide polymorphism or the mutation are connected. Indian women are very easily mutated their genes. The reasons is there is a mismatch of the things what she act with their partners, and maybe the reason it is all about the mismatch. Gene studies is potential genes and there is a mutations. Why the mutations is there? If it's a natural phenomena, but the mutations consistently mutated, each day is mutated, it may the sign of the sign of the worry. So that is not in our hand. So if they understand, we are ready to to share what they want. The pathophysiology of the PCOS is almost frequently mediated by the gene encoding signal element related to the sterogenesis, steroid hormone action, gonadotropin action, control insulin action, and secretion. That is all about the genes playing the role that is known as genetic marker, enhance the diagnosis, as well as there are the gene therapy. Diagnosis is there. It is a top level therapy for the PCOS as well. The woman needs to understand that why she is mutated, why she has a early aged. So there is a reason to worry. Gut microbiota dysbiosis, critical correlation. Gut microbiome is made up of the approximately 10 to the power 13 microorganism that collectively have almost 200 times more genes than the human genomes. That is abnormalities 200%. Making organs on its own. Gut dysbiosis appears to be the root of the inflammation and alteration of the gut permeability, which can then affect the host health. Yes, host health should be the affected without hope of due to occur by the inflammation and the alteration. Under the physiological conditions, a delicate balance should be important. That should be the gut microbiota and hosts that influence the physiology, metabolism, nutrition, and the human function, in addition to playing the significant role in the prevention of the various diseases. Between healthy adults, substantial variance in the microbiome composition, it should be a natural. If their composition should be something should be not fit into the list, it may cause the gut microbiota dysbiosis, and this variance may contribute to susceptibility to the disease. It is either it should be the removed or you should be take aside of the unmatched. Treatment specific need to the patient therapy include the ameliorating hyperandrogenic symptoms, including ovulations, regulating menstrual cycle, and preventing cardiometabolic complications. Women with PCOS, irregular menstruations, that is one of the reasons. Hirsutism and infertility cause are the most distressing symptoms due to complex etiology of the PCOS. Treatment is monotherapeutics, rather being personalized based or prevailing the sign of the symptoms. It may the medical cause for the treatment. There are several treatment, but to approach should be a right. Several complementary therapies are there. Management and treatment of the PCOS. Diet, lifestyle changes are the regarded. Yes, they will be the part. But cornerstones of the PCOS is the management is important. Different pharmacological and non-pharmacological interventions can be the use. It's an intervention is important. Menstrual irregularities, androgen-related symptoms, and infertility, ovulation. This is a list of the reason. For the regulation of the community of the PCOS, there are the numerous approaches, and numerous approaches, I'm not saying approaches are the limited, and these are the important. Potential benefits, however, it is also crucial to acknowledge that no single treatment can be fully addressed. It is a list of the treatment when you get into the PCOS disorder, abnormalities, and the diagnosed woman. Combining lifestyle changes with medication of the various alignment result to greater metabolic benefits, especially after the 2015, the metabolic rate should be the reduce. the 90% population, they may affect the metabolic benefits, need to the improvement in the metabolics. Time is in their hands. Time is running out, but they may take the advantage at that from the right treatment, how they come out from that. Plasma metabolism and gut microbiota composition, it may the factor. They may characterize for the PCOS treatment in addition to focusing the primary traits is there. Oral contraceptive and anti-androgens. Oral contraceptive are the first line management protocol for the menstrual abnormalities and acne in women with PCOS. PCOS function by encouraging negative feedback on LH secretion, which leads to the less androgen production in the ovaries. That is one of the reasons to control androgen production. Reduce the hyperandrogenism. That is one of the signs to reduce to that. They raise the liver, reproduce the SHBC while lowering the blood level of the free androgen. OC also work. OC mean oral contraceptive, inhibiting the peripheral conversion of the testosterone into the hydrotestosterone binding DTS to androgen. It's all about the imbalancing of the woman's hormones. They may contain the androgen level. It's a list of the reason, but maybe the main reason is to that the how women's are satisfied as she has the women's. So it has the it may the opinions is important, but when it is not the balance, ultimately the androgen secretion is more in the woman's. So it is need to the balance of their physical satisfaction. Maybe it is one of the reason, because it's in a presentation. The research is available. Reputed journals, reputed scientists are available on the Google. They may check. If anyone want to, they will go to the internet and they may assess some information, and they may add into their knowledge, they may add into their experience. Ovulation inducers. Ovulatory dysfunction is one of the diagnostic criteria for the PCOS patient, and ovulation induction in an effective treatment for the PCOS patients with the fertility requirement. And ovulations in the PCOS associated with the low FSH level and arrest the antral follicle growth during the final stage of the maturations. The overproduction of the LH, that is one of the reason. Again, I am saying the overproduction of the androgen. Insulin may also work together. Things is there overall, it has been seen that how the woman is not as strong. Their physics is not aligned with the nature. That is one of the reason. Treatment is more. Treatment is the list of the treatment is there, but the right approach, right people, right match, it is difficult. That is one of the reason to the PCOS. It may the things is there. That is, it is a thought that the women with PCOS have a relative decrease the aromatase, which reduce the production of the follicle responsible for the effective ovulation. Reduce the production of the follicles. Yes, at on day, their working day, their workplace, they reduce the production of the follicle responsible. So she will come out from the abnormal PCOS. Future perspective. Clinically, PCOS is a complex condition with a lifelong complications and prevent disorder in women's or reproductive age. The most challenging aspect of this syndrome are the imprecise diagnosis criteria and the enormous complexity and the characteristics. The timely implementation of the personalized therapy approaches will enhance the PCOS management overall, reduce the comorbidities and improve the quality of the life. To improve the prognosis, early stage treatment are necessary for the female who may experience the infertility during their reproductive age. Key genes polymorphism may be useful. Early PCOS subtype diagnosis and screening. Further study on the genetic and pathophysiology of the PCOS will be necessary. Identify the effective prevention strategy and the therapeutic approaches. Additional research is required that I have quoted the three observations that is important to the microbiota changes as a result of the steroid alterations. Androgens I was speaking, and the process behind the PCOS patient, that is a prebiotic, probiotics, and symbiotics implementation in the woman's PCOS appears to improve the numerous biochemical finding. Favorable things will be we can expected. More research is needed to determine the significance of this medication in PCOS therapy. Maybe the prevention, randomized clinical trials is there, elucidate the mechanism underlying the association between the gut microbiota dysbiosis and PCOS. Future comprehensive and functional research will allow the use of the gut microbiota as a biomarker for the PCOS, and targeted personalized manipulations of gut microbiota will help to enhance the research. There is no panacea because treatment have so far been directed to the symptoms rather than the illness itself. Excessive effort should be undertaken, thoroughly investigate the symptoms, therapy, and delay the seriousness long-term impact of the disease on the patient health. That has been seen for the, especially for the such a type of the country. Several emerging therapies for the treatment of the T2DM may have the direct utility in the management of the metabolic aspect of the PCOS. However, the clinical, what they want to evaluate their clinical efficacy and safety in the women with PCOS. Additional investigation are required to prove the potential of the emerging therapies such as miRNA therapies, IL-22 therapies, and others in the positively treatment PCOS. The specialized scientists, they may handle to the this type of this therapy. I would like to mention here. Acknowledgement, important slide. I would like to express my gratitude to highly respected world-renowned scientist, Dr. Ramesh Paranjape, esteemed laboratory scientist and retired and the long-time director of the National AIDS Research Institute, Pune. Being a great knowledge source for this work, I seek continuous support for my research career. Thank you. Yes, the audience, you have the any further question, so I will answer your query. You can share me if you want to add in this work.